Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, today we're talking about plantar fasciitis. We have a new treatment for an old stubborn problem, and it is a stubborn problem.
Oh yeah, it absolutely is.
I mean, we've treated a lot of people with plantar fasciitis, and I have to be honest, some of them just don't get better. It seems like it requires natural history, that they're going to just get better on their own.
Yeah, months sometimes, but sometimes you can get after it, and it
gets better.
Yeah.
So first off, just real quickly, Brad, you want to show where the plantar fascia is?
You better believe it. So we're looking at the foot right here, and if we look at our skeleton Bonaparte guy, we've got some red tape to help show.
That's the tough fascia.
Right, connects to the
tough
heel
band.
here, connects to the right to the ball of the foot there, and you can see there's some flexibility in it. This is just a model of kind of how it works, but that fascia gets inflamed, and it usually hurts back by the heel.
Yeah, right here, and often more towards the arch.
Right,
Yep,
so we're talking
right
about right there.
Okay. Well, let's start off, Brad. The first thing we want you to do, before we get to the new treatment, which involves these balls and this tray, this track, I should say, we're going to show an old stretch you should do for it.
Sure.
So you want to get up on this chair, Brad?
You bet.
You can get up there, old man?
Oh.
All right.
Bob.
All right, so what he's going to do, he's going to take the towel, and what we're going to do is going to stretch the toes up like that is all you're doing with this. So you put the foot on there like this, and you're going to grab onto the towel, and you're going to go ahead and keep the foot down, and you're going to pull the toes up and give it a good, minute or two stretch. You can do that a couple times a day.
Yep. You like a sustained stretch or the oscillated,
You could
Bob?
do it. You could do the pressure on, pressure off, or you could do the same stretch, sustained stretch too.
Sure, you
So-
bet. It's mostly on the big toe, correct?
Right, mostly on the big toe. Exactly. All right, moving on. Now, this product was made by Massage Track.
Sure.
Okay, and this is called the Body Track, and you can use it for a lot massaging or doing trigger point therapy, basically on a large part of your body, a lot of number of parts of your body.
Right. Mm-hmm.
But we're going to today use it for the foot and the calf.
Sure.
And this specifically, my wife used this for plantar fasciitis, and it really has helped her. Now, this comes with the Body Track, but you can also buy balls from them. I think these are like lacrosse balls. They're very hard.
Yep.
You can just use some balls you have laying around, like a tennis ball.
Right.
But like you just said, Brad, these actually feel a little bit better, don't they?
Right. Yep. They're a little firmer.
So, all right, just why don't you hold on to that, Brad, real quick. I'm going to show you on this thing, on the Body Track. On here, you see where there's just a thin space between the two balls, and here's a little bit of a thicker or wider space between the two balls. So that gives you two different options when you're going to put two balls down, and I'd first go with the narrow track. Why don't you show your foot, Brad, like this? So the narrow track, you're going to work along the ball of the foot too, I guess. And you can also go to the wider track. Now, they recommend, and I recommend too, that you definitely want to watch their video on doing the treatment before you do this, because what they recommend is that you find your pressure point, hit a spot. You might even want to start off the tender spot, Brad. Probably more on a spot that's not so tender.
All right. If this is a tender spot here, we're going to start here.
Right.
And then work towards it.
Yep, so you push down, you're going to put pressure down, and you're going to put pressure for at least 12 seconds is what they recommend, up to a minute. And if you're pushing down and it just gets worse, that's probably too tender right then, and you maybe need to go to a different spot, or you maybe need to put lesser pressure on it.
Right. Sure.
So that's the one way you're going to work it, with the balls being very close together. You're going to work it with the balls being very close apart. And what they recommend is, so you hit a spot for the 12 seconds up to a minute, and then you move a half inch and hit another spot for the 12 seconds up to a half minute, or up to a full minute. Make sense, Brad?
Right. So basically, it's a soft tissue mobilization, what we call it. It's getting in there and breaking up some of that scar tissue, loosening things up to get the
Kind of a trigger point therapy,
Sure.
as I would say.
Yep.
Now, before we go on to the calf, the other way my wife used this, and they did not recommend using it this way, but I think this makes sound sense physiologically, is she actually turned the tray the other way, and she put down one ball, and she actually rubbed back and forth like this, like it was more of a cross fiber massage. And that worked out very well for her. So
I'm saying do what works. You
Yeah,
can
do
try
what
either way.
works.
It's not going to harm anything. I personally like to actually, I understand the hold for 12 to 30 seconds.
12 seconds to a minute.
Up to a minute, yeah, but I don't have the patience for that, so that's never going to happen with me. I'm just telling the truth, Bob. I will definitely do this and the other one, and I'll hold it too, but
Sure.
I know a 30 second stretch, hold, blah, blah. It doesn't work with me. I
Sure.
can't practice. It just.
And in that case, Brad was using the single ball, which is recommended too. You can do the double balls and then go to the single ball
Sure.
too. So, all right, why don't we show how to do the calf, Brad? So,
Oh, yeah.
so
I thought we were talking about cows and calves, but.
So we'll move this down. Good.
All right.
It's going to be the same principle on the calf. So again, we got the balls fairly close together on the more of the narrow tracks. And same thing, you find a spot, and yeah, he's going to have to lift his butt up in order to do this.
Lift your body up with your arms. You
Yeah.
need a little arm strength.
If you're on the floor, you can actually even put this leg on top of the other one like that if you want to really give it
That's
to it.
aggressive.
That's aggressive, yeah. So otherwise, you can just kind of, you can put that foot up on the table like
Yeah.
that too. There's, you can vary the pressure that way.
Yeah, because you're going to do it on your living room floor, probably.
But even with plantar fasciitis, you want to make sure this structure is all stretched out too. You want to have plenty of movement on all the structures because this does come down and attached into the heel.
Right.
Too.
Basically, from here all the way up to here, we got
Yeah.
a big line of
So you're
tissues
gonna-
connected.
Again, the same thing. You're going to go 12 seconds to a minute. Each section, go another half inch and move it along.
So this is something that takes sometimes you're going to have to schedule out in a few minutes to do it. Just get it in your mind to do it, and yeah, it'll work that
Well,
soft
as
tissue.
I always tell our patients, Brad, it takes you a long time to develop these problems, so they're not going to go away overnight. So you're going to have to work on them a long
Right,
time too.
right.
Now, a lot of you might be thinking, well, why can't I take just a couple balls and do this on my own?
Sure.
You can try it, but I have to be honest, the track makes it much better. And, the balls don't roll away on you, and they keep in line.
Yeah,
and
a little more control.
a little more control. The other thing, what my wife did is she just put it underneath her desk at work.
Oh,
and
yeah.
with the balls there. And so one thing about plantar fasciitis, whenever you try to get up after sitting for a while, it's that ow, 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 ow.
Yep.
So she'd roll her foot before she'd get up, and then that would take away the pain.
Sure.
So that worked
Nice.
out really good for that. So
Yep.
very much of a convenient thing.
Yeah.
What did I say it is, Brad? About $50?
Right. Mhm.
$50 for this. You can also buy 8 balls for about $60.
Right.
So, and then they have some other ones too. We may talk about those at a future video.
Sure.
So,
Okay.
All right, thanks for watching. And do you want to fix a broken heart today, Brad, or no?
Well, I don't know. What do we got here? Yeah, he definitely needs fixing here. We got that bone apart. If that heart's broken like this, and the poor guy just went through some terrible trauma, just come to us. We never did this yet, but we got
We can fix just about anything, but we
stapler.
can't fix a broken heart, as you can see.
Yeah,
It's just
that's
not
working.
working.
I think it's going to work this time, Bob.
Yeah, all right.
Yeah,
Thanks a
it's
lot
fixed.
for watching.